When the patient arrives in the department, they will speak to a member of staff who is able to assess if they have correctly prepared for the test. Taking a brief history from the patient and making sure that they have followed the correct preparation is an important part of performing a PET-CT scan. It must be done thoroughly and accurately, as if it is not done correctly, then there is a risk that the scan may not be diagnostic, which in turn means that the patient has received an unnecessary radiation dose.
It's very important to prepare a patient for a PET scan prior to their test, because if they arrive not being prepared, so say they've eaten or they've exercised strenuously that morning, we can create uptake where there shouldn't be uptake. We can create false positives. You can have a false negative. If the patient has eaten, then what you inject in them, if perhaps you're doing an FDG patient, you inject them, then what you inject isn't going to go where you need it to go. You're not going to get the right SUVs, you're not going to get the right values. So it's very important that the patients understand ahead of time exactly what the prep is for that study.
Getting an accurate and relevant history from the patient is also vital for passing on information to the reporting radiologist, as they do not have the ability to speak to the patient directly. This means that certain things which may be demonstrated on the resulting images need to be documented so it can be accurately interpreted. This can include any healing processes, for example, recent dental work, a fall, or injury. As already explained, FDG will get taken up by several processes that may be unrelated to the clinical question. But if this increased uptake is in an area of concern, then it may affect the accuracy of the resulting report. Both glucose and FDG are actively transported into cells. Before an injection of FDG, the patient will need to have fasted for 6 hours and only had plain water to drink. The patient should be encouraged to drink though, as being well hydrated helps to reduce the radiation dose to the bladder by lowering the concentration of FDG within the urine. This period of fasting prior to the FDG injection is done to reduce the patient's blood glucose level and prevent any competition between the injected FDG and glucose already present. High levels of blood glucose can mean that there is little difference between any tumour uptake and the rest of the soft tissue, resulting in very low contrast images.
It's important to prepare the patient before a PET scan because it ensures that the patient is compliant for the test. In the preparation that the patient receives, they'll get information, for example, on if they need to fast. For an FDG PET-CT scan, it is important that the patient is fasting. If the patient's blood sugar level is quite high, because they've just eaten or had a fizzy drink or sugary drink, and you inject them with the FDG, then the uptake of the radioisotope can be reduced as the body's normal blood glucose level has been saturated in the cells. It's important that they have been fasting for 6 hours prior to their FDG procedure.
One of the things we ask patients to do is for the FDG, for example, it's one of those ones where you look at the glucose uptake within the body compared to normal glucose levels. And so what we do is we starve the body because cancer cells tend to be more active and so they're very greedy. So every time glucose enters the system, they'll be grabbing that energy to do the task they want to do compared to the rest of the cells. So we will ask patients to fast for 6 hours before. They are allowed to have sips of clear water. And of course now with everything decaf and, you'll say to patients, don't have tea and coffee, then they have a hot chocolate. So you've got to be very explicit what is and isn't allowed for the patient to be clear and have a good understanding.
A check of the blood glucose of the patient is done and documented prior to giving the FDG injection. Here is an example of a patient that has not fasted prior to the examination.